Hey class, how's it going? So for our reflection in our specific case study, we're working with a male who's in his 60s, who's an avid tennis player, who's been having a couple bouts of discomfort and inefficiencies with his movements that's kind of causing a detriment to his ability to play tennis. In our reflections, we have different ideas of what stretches and stretching routines are going to work best. I'm going to give an example of three different stretches that I think are going to be beneficial to this patient. And more importantly, I'm going to show you what they look like so that if this were to happen in their day to day life, it's something that they can incorporate easily. The stretches I'm going to be going over are an across the chest arm stretch. So that's going to work on the shoulder, opening up the shoulder, and specifically working on getting the range of motion for the backhand that the tennis player needs to be able to accomplish to be successful on the court. We're going to be talking about a sideways bend with a bent arm, and I'll explain a little bit more about that. And then finally, we're going to end off with a simple hamstring stretch. So to get started, an exercise that's going to work on a little bit of mobility for the shoulder while also opening up the upper back, which is a nice thing. We're going to be working on a couple of different places at once. Is going to be that reaching across basic stretch that you learn in gym class growing up. We're going to keep our arm flexed at about a 15 to 30 degree angle, coming across to our alternate shoulder. We're going to grab the elbow. We're going to be pulling across until we feel a stretch in that shoulder socket. Now, each one of these stretches we're going to hold for about 30 seconds. So I'm going to grab my handy dandy timer here on my phone, and we're going to go ahead and make sure that we can get the best stretch from the amount of time that we have available. So like I said, 30 degrees. We're holding as we stretch across. It shouldn't be a painful stretch, and it is more of a basic stretch. There are a couple alternatives that we can do in terms of stretching the shoulder. Here's going to be a very basic one. The idea that I have behind choosing this stretch is we're working with a patient who hasn't been comfortable doing flexibility training, so they don't stretch often. And being in their 60s, it's something that's going to be very difficult to just jump into and use really intense stretches. So making something very basic so they can understand is really going to go a long way in terms of making sure we have adherence to our stretching protocols. So holding that stretch for those 30 seconds right at the elbow, bent just a little bit, and I'm going to lean forward so you can see it's not a completely straight arm. We keep it at about 15 degree flexion, and we're coming right back there. And the next stretch we're going to be working with, and I'll step up out of the chair for this one, is going to be a bent stretch with a bent arm, or a side bend with a bent arm. The idea behind this one is we're going to be stretching out our latissimus dorsi, a couple of the muscles in our back, and we're also getting extra work on our shoulders. So doing multi-joint stretches, that's really going to benefit our patient and gaining that range of motion so that they're functional when they return back onto the court. So with this one, the idea is using the right arm on this one again, coming over the back, as you can see here, just a normal range, and we're not putting too much pressure when we're going up to that point. Our contralateral arm, we're going to take the hand, push down to get a little bit of extra stretch on the shoulder, and on the arm you'll feel it in the posterior tricep area. And then keeping our legs about shoulder width apart, we're going to lean to the contralateral side. So we're going to bend, and that's going to open up that latissimus dorsi for us. So we hold that stretch again for 30 seconds. And the idea here is by adding the hand to pull down, we're stretching from two different positions. One, our body is going to be using gravity and the effects of gravity to start that latissimus dorsi stretch. But because we're using that alternative hand to push down, we're causing a stretch from a superior and a inferior point. So we're getting a stretch on both sides, and we're really adding on to the stretch that this is going to be able to cause. And I'll cut that one just a little bit short, just for the sake of time. The last one that we're going to be focusing on is a seated hamstring stretch. This could be done standing. The idea behind this is our patient is feeling some pain when they're hinging at the hips. So this is going to be a way of loosening up the hamstrings to avoid any kind of lower back pain they might be feeling. Idea behind this one, I'll give you guys a lateral view. We're up nice and tall. Leg is going to be straight in front of us, toes pointed to the sky. We keep our knee flexed. I apologize for that. Now from here, nice and tall, we take a deep breath. We're hinging at the hips. We're coming forward, we're leaning forward, and we hold it right there. It doesn't have to be too much of a stretch. Some of our patients are going to be here and feel a stretch. Some people will be able to bend all the way to the floor. The idea is we're nice and tall, core engaged, keeping that leg straight, toes up to the sky, and we hinge at the hips. That hinge at the hip motion is going to be the most important part here because that's what our patient is having difficulty with in their day-to-day life, and especially when they're playing tennis. So again, we're holding this for 30 seconds. This is going to be a stretch that you can incorporate throughout your day-to-day life, whether you're in an office and you need to stretch a little bit, you see a stair and you want to use that same kind of forward lean. We're going to gain the benefits of all of this with a simple motion. And again, these simple motions are chosen so that we can start our patient off with something that's a little bit more doable. It's not too intimidating from the beginning. We're able to incorporate things that they're going to be comfortable in intertwining into their day-to-day lives. And for that reason, we'll see better adherence. And with that, we'll see better results in what our patient's doing a few weeks down the line. To see improved results from the testing that we've all done to see any deficiencies in their motion. Thank you for your time. I appreciate that. And if you guys have any questions, don't hesitate to reach out.